Part A. Extract 1. Questions 1 to 12. You hear a dermatologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. I'm Dr. Andrew Alburn, a dermatologist. Could you describe what's been bothering you?
Good morning, doctor. I've been dealing with some really persistent issues with my nails. A few months ago, I noticed that my nails started looking a bit odd. It began with a faint discoloration under the edge of my left thumbnail, like a yellowish tinge. Honestly, it's becoming quite distressing. I didn't think much of it at first, but now it's spread to a few other nails. They've become brittle, thicker, and oddly shaped. Sometimes, parts of the nail seem to lift off the bed entirely, and there's this strange chalky debris underneath.
I see. Is this affecting only your fingernails or your toenails as well?
Both, unfortunately. It's worse on my toenails, especially the big ones. The skin around them feels inflamed and tender at times, particularly after wearing tight shoes or walking long distances. And there's this embarrassing odor. It's not overpowering, but it's noticeable.
That does sound troubling. Can you tell me more about your overall health and lifestyle?
Well, I try to stay active. I go to the gym about 3 times a week, but I admit I sweat a lot, especially during spin classes. I usually wear sneakers, and they get damp pretty often. I haven't always been great about changing them out or letting my shoes air properly. At home, I tend to walk around barefoot, but I've noticed that the floor in my apartment sometimes feels a bit damp.
That's helpful to know, Mihira. Have you tried any treatments for this?
Oh, yes. I've been trying so many things. Initially, I thought it was just dryness or maybe trauma from a stubbed toe, so I used regular moisturizers. I even soaked my feet in apple cider vinegar and tea tree oil solutions because I read online that they could help. When that didn't work, I bought some over-the-counter antifungal creams and nail lacquers. But nothing seems to make a lasting difference. The condition just keeps getting worse, especially on my toenails.
Based on what you're describing, this sounds like onychomycosis, which is common. It's a fungal infection that can be quite persistent and often requires targeted treatment.
Oh, I didn't think it could look like this.
It can be presented in various ways. Treating this condition can be tricky, as it requires both patience and consistency.
What kind of treatment would you recommend? Should I continue with those natural remedies?
While home remedies like vinegar or tea tree oil might provide temporary relief, they're usually insufficient for severe cases like yours. I would recommend a combination of systemic and topical treatments. For systemic treatment, I'd prescribe terbinafine tablets. These work internally to target the fungus but can take a few months to show full results. You'll need a blood test before starting to ensure your liver function is healthy, as these medications can occasionally have side effects.
Okay, that sounds like a plan.
For topical treatment, we'll use amorolfine, applied once or twice weekly. You'll need to file down the affected nails before applying the lacquer to improve penetration.
Thank you, doctor.
Extract 2. Questions 13 to 24. You hear a neurologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. I'm Dr. Larson Headfield, a neurologist. Please take a seat. Can you tell me what's been going on?
Doctor, over the past few months, I've been experiencing occasional weakness in my hands, but now it feels more persistent. I also noticed that I'm dropping tools at work, which is worrying because I'm a carpenter and use my hands all the time.
I see. Can you describe the condition in more detail?
It's mainly my grip strength. I find it hard to hold small objects, like nails or screws, and my fingers feel stiff sometimes. It's also affecting my arms. There's this odd feeling, almost like my muscles are wasting away.
That must be distressing, especially given your occupation. Mihira, have you noticed any other symptoms?
Yes, actually. My muscles sometimes twitch, almost like they're jumping on their own, and I've been feeling clumsier than usual. I even stumbled a few times last week when I wasn't paying attention.
Thank you for explaining that. Have you experienced any difficulty with speech, swallowing, or breathing?
Not really with breathing, but sometimes my voice feels a bit hoarse and I choke on water occasionally. I thought it was just because I wasn't being careful.
I appreciate your honesty, Mihira. These details are crucial in understanding what's happening. Do you have any family history of neurological conditions?
Not that I know of. My parents were healthy, and I don't think anyone in my family had problems like this.
Understood. Let's move on to an examination to assess your symptoms further. Based on your symptoms and what I've observed during the examination, I believe you may have a condition called amyotrophic lateral sclerosis. This is a progressive neurological disorder that affects the motor neurons in your brain and spinal cord.
Is it serious?
Yes, it is a serious condition, as it leads to the gradual weakening of muscles. However, the progression varies from person to person, and we can take steps to manage the symptoms and improve your quality of life.
What kind of treatments are available?
Treatment focuses on slowing disease progression and managing symptoms. We often prescribe medications like riluzole to reduce the damage to motor neurons and edaravone, which may slow functional decline. Physical therapy is also essential to maintain mobility and prevent stiffness.
Will I be able to continue working?
You may need to make adjustments as the condition progresses. Using adaptive tools or considering lighter duties might help in the short term.
Okay, understand.
We'll work with occupational therapists to keep you as functional as possible for as long as possible.
I appreciate your honesty, doctor.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a triage nurse called Mihira talking to the patient's carer. Now read the question.
Mr. Tim, I'm concerned about Mr. Franklin's condition. He's been experiencing shortness of breath and chest pain.
That's concerning. Have you assessed his vital signs, Mihira?
Yes, his blood pressure is elevated and his heart rate is rapid. We've administered oxygen and pain medication to alleviate his symptoms.
We should consider transferring him to the emergency department for further evaluation. A cardiac event is a possibility, given his symptoms and medical history.
I agree. We'll prepare him for transfer and notify the emergency department about his condition. We should also contact his cardiologist to inform them of the situation.
Good, Mihira. Remember to document all interventions and vital signs. We'll need this information for the emergency department and his ongoing care.
Now look at question 26. You hear a GP called Mihira talking to a pharmacist. Now read the question.
Pharmacist Tim, I'm concerned about Mr. Franklin's medication regimen. He's experiencing some side effects from his current medications, including nausea and dizziness.
That's concerning Dr. Mihira. Let's review his medication list and identify any potential interactions or adverse effects.
I've checked for interactions, but I can't find anything significant. Perhaps it's an idiosyncratic reaction to one of the medications.
We could try adjusting the dosage or switching to an alternative medication. However, we need to consider the potential impact on his overall health.
That's a good point. We should discuss the risks and benefits of each option with Mr. Franklin. We might also need to consult with a specialist for further advice.
I agree, Dr. Mihira. It's important to involve Mr. Franklin in the decision-making process and ensure he understands the potential risks and benefits of each option.
Thank you for your input, Tim. We'll work together to find the best solution for Mr. Franklin.
Now look at question 27. You hear a physiotherapist called Mihira talking to an assistant. Now read the question.
Assistant, please prepare the patient for the hydrotherapy session. Ensure the pool temperature is maintained at the optimal level and the necessary equipment is ready.
Certainly, Mihira. Should I assist the patient into the pool, or would you prefer to do it yourself?
I'll assist the patient. Please ensure the pool area is clean and free of any potential hazards. Double-check the water quality and pH levels.
Yes, of course. Should I prepare the exercise plan for the session?
That would be helpful. Please review the patient's medical history and tailor the exercises accordingly. We need to focus on improving their range of motion and strength.
Any specific exercises you'd like me to emphasize, Mihira?
Prioritize exercises that target the affected areas, such as the knee and ankle. We can incorporate balance exercises to enhance stability and prevent falls.
I'll prepare the necessary equipment and assist you during the session.
Now look at question 28. You hear an occupational therapist called Mihira talking to a nurse. Now read the question.
Nurse Tim, I'm concerned about Mr. Franklin's progress in occupational therapy. He's struggling with activities of daily living, particularly dressing and grooming.
That's concerning Mihira. Has he been experiencing any pain or discomfort?
He's reported some stiffness and weakness in his upper extremities. We need to address these issues to improve his functional independence.
Perhaps we should consult with a physical therapist to develop a comprehensive rehabilitation plan.
That's a good idea. A combined approach from occupational and physical therapy can be beneficial. We can work together to improve his strength, coordination, and fine motor skills.
How can we motivate Mr. Franklin to participate actively in therapy sessions?
We can set realistic goals and celebrate his achievements, no matter how small. Positive reinforcement can boost his confidence and encourage him to keep working hard.
Mihira, we should also involve his family in the rehabilitation process. They can provide support and encouragement at home.
Absolutely. Family support is crucial for successful rehabilitation. We can educate them on how to assist Mr. Franklin with daily activities and provide them with specific exercises to practice at home.
Now look at question 29. You hear a head nurse called Mihira conducting an induction program for junior nurses. Now read the question.
Welcome to our team, new nurses. This induction program is designed to familiarize you with our hospital's policies, procedures, and culture.
Thank you, Mihira. We're excited to be part of this team.
To ensure patient safety, it's crucial to follow our infection control guidelines meticulously. This includes proper hand hygiene, wearing appropriate personal protective equipment, and adhering to isolation precautions.
How do we prioritize tasks and manage our time effectively?
Effective time management is essential in our fast-paced environment. Prioritize tasks based on urgency and importance. Use tools like time management techniques to organize your workload.
What are the communication protocols we should follow?
Clear and concise communication is vital in healthcare. Use SBR, situation, background, assessment, and recommendation when reporting patient conditions to ensure effective communication.
How can we maintain a positive attitude and manage stress, Mihira?
Self-care is crucial. Practice stress management techniques like mindfulness and meditation. Seek support from colleagues and supervisors when needed.
Now look at question 30. You hear a doctor called Mihira talking to a nurse. Now read the question.
Nurse Tim, I'm concerned about Mr. Franklin's condition. His blood pressure is elevated, and he's complaining of chest pain.
Yes, Dr. Mihira. I've noticed those changes as well. He seems to be in discomfort.
We need to act quickly to prevent any complications. Let's administer oxygen and monitor his vital signs closely. We should also consider administering nitroglycerin to relieve the chest pain.
Should we prepare for a possible cardiac event?
It's always best to be prepared. Let's have the cardiac arrest team on standby and ensure that all necessary equipment is readily available.
What about pain management, Dr. Mihira? I'll inform the team about the changes in Mr. Franklin's condition and ensure that they're prepared to respond to any emergencies.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a school health nurse, Mihira, and an interviewer.
Mihira, being a school health nurse must be a unique experience. Could you share some highlights of your journey in this field?
Certainly. The journey has been both demanding and rewarding. Each day brings a blend of challenges and triumphs. What strikes me most is the profound sense of responsibility. You're not just tending to physical ailments, you're shaping lives, fostering environments that support growth, and sometimes being the confidant students desperately need. Over the years, I've found that it's less about routine and more about intuition, discerning the unsaid and acting swiftly when a child's well-being is at stake. I've worked through outbreaks, navigated mental health crises, and advocated for better school policies. This ever-evolving nature keeps the role dynamic and impactful.
That sounds intense yet fulfilling. How does it feel to carry such a significant responsibility, Mihira, knowing you directly impact young lives?
It's a complex mix of emotions. There's immense pride in knowing you're a pillar of support for these children, but also a constant undercurrent of concern. Are you doing enough? Often, you're the first to spot subtle signs of distress that might go unnoticed, which feels empowering but also adds pressure. Balancing clinical detachment with emotional involvement is a tightrope walk. For instance, there are moments when you see students overcome illnesses or behavioral challenges, and you feel an overwhelming sense of accomplishment. But there are also instances of helplessness when systemic constraints hinder optimal care. The role tests your empathy and resilience in equal measure.
It's clear this role demands a lot of emotional and professional investment. Mihira, what led you to choose this path in the first place?
That's a story rooted in my own childhood. I grew up in a rural area where healthcare in schools was a rarity. I remember classmates suffering from undiagnosed conditions or untreated injuries simply because there was no one to address their needs. That stayed with me. Later, while pursuing nursing, I realized how pivotal early intervention is in shaping health outcomes. The idea of bridging that gap between healthcare and education resonated deeply. School health nursing is unique in its preventive focus. It's about creating healthier futures rather than just treating present ailments. It's a chance to mold the health trajectories of entire generations.
That's inspiring. Speaking of health trajectories, Mihira, what are the common issues you encounter among students?
The spectrum is surprisingly vast. Physically, you deal with everything from allergies and asthma to injuries sustained during sports or other activities. But the real challenge lies in mental health issues, anxiety, stress, even depression. Today's students face pressures that were unthinkable a decade ago, thanks to academic expectations, social media, and the post-pandemic landscape. Another overlooked concern is nutrition. I've seen too many cases of students either skipping meals or indulging in unhealthy diets, leading to chronic issues later. Beyond these, there's a growing need for education on reproductive health, which remains a taboo in many communities. These aren't isolated issues, but interconnected threads affecting a child's holistic well-being.
That's a multifaceted responsibility, Mihira. How do schools like yours equip you to handle these diverse challenges?
Facilities are a critical aspect of school health services. At our institution, there's a well-equipped infirmary, access to psychological counselors, and regular training for staff to handle emergencies. Additionally, technology has become an ally. Electronic health records help track a student's history, enabling timely interventions. We conduct routine health checks, vaccination drives, and workshops on topics like mental health and hygiene. However, collaboration is key. Teachers, parents, and external healthcare providers form a network that ensures students receive comprehensive care. The school also runs peer support programs where older students are trained to assist younger ones in recognizing health-related issues. This multi-layered approach has proven effective.
Impressive as it is, what areas do you think need improvement to make your job even more effective, Mihira?
There's plenty of room for growth. For one, The ratio of health staff to students is woefully inadequate in most schools, including ours. Then there's the stigma surrounding mental health. Despite awareness campaigns, students are often hesitant to seek help. Funding is another bottleneck. Many initiatives fail to take off due to budget constraints. Another crucial gap is parental involvement. While some parents are proactive, others see health education as a school's sole responsibility, which limits progress. I believe systemic reforms, like integrating health education into the curriculum and mandating better health policies, are long overdue. Technology could also play a larger role. Imagine AI-powered early warning systems for health risks. The potential is immense. We just need the will and resources to harness it.
Now look at Extract 2. Questions 37 to 42. You hear Matt Rodens, a physiotherapist, on advanced equipment research at Mihira Healthcare Institute. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. It is both an honor and a privilege to discuss our latest strides in advanced physiotherapy equipment research at Mihira Healthcare Institute, or as many of us fondly call it, Mihira Care. Our focus today revolves around the groundbreaking work our team has been conducting to redefine how physiotherapy integrates with modern technology and patient-centric care. At Mihira Care, our primary focus is to bridge the gap between physiotherapy science and engineering innovation. The Institute has been tirelessly working on developing smart therapeutic devices that not only address conventional rehabilitation, but also adapt dynamically to patient feedback. The overarching aim is to personalize therapy protocols using AI-driven insights, thus enhancing efficacy and efficiency. Our research spans exoskeleton technology, wearable motion analysis systems, and bioresponsive diagnostic tools. One of our most ambitious ventures is the creation of modular rehabilitation suites, comprehensive setups tailored to cater to diverse patient needs, from post-operative recovery to chronic pain management. These suites combine biomechanics with cutting-edge automation, ensuring that therapy sessions are both impactful and adaptive. This dual focus on technology and individualization is what sets Mihira Care apart. The implications of our research extend far beyond mere technological advancements. It signifies a paradigm shift in physiotherapy practices, emphasizing preventive care as much as rehabilitative measures. With our data-centric approach, Mihira Care aims to predict complications before they escalate, allowing physiotherapists to intervene preemptively. For instance, AI-integrated equipment monitors micromovements during sessions, providing real-time data to prevent incorrect postures or ineffective exercises. Such insights can revolutionize the patient-therapist relationship by fostering transparency and trust. Furthermore, the availability of accessible and scalable solutions will democratize advanced physiotherapy, making it feasible for rural and underprivileged populations, a core mission of Mihira Healthcare Institute. While physiotherapy has seen remarkable growth, it faces three significant challenges: accessibility, consistency, and adaptability. Many patients in remote areas still lack access to even basic rehabilitation facilities. Conventional equipment, though effective, often fails to account for individual variability, leading to generalized protocols that may not cater to specific needs. Moreover, the inconsistency in patient adherence to therapy regimens exacerbates recovery times. Existing tools lack mechanisms to monitor compliance or provide motivational cues. Mihira Care's research addresses these issues through smart designs. By incorporating gamification elements into rehabilitation equipment, we aim to transform monotonous routines into engaging activities, encouraging patients to stay committed. Looking ahead, the vision of Mihira Care is to transition from reactive to proactive healthcare. Imagine a world where wearable devices alert physiotherapists about potential joint strain before symptoms manifest. By integrating physiotherapy with telehealth platforms, we envision patients receiving personalized guidance from Mihira Care experts regardless of their geographical location. Our focus also extends to creating hybrid rehabilitation systems that combine physical therapy with virtual reality environments. Preliminary trials show that patients recovering in virtual simulations, whether walking in serene forests or navigating familiar streets, exhibit improved psychological and physical outcomes. Mihira Care believes such innovations can redefine recovery experiences. However, translating vision into reality is no small feat at Mihira Care. We follow a multidisciplinary approach, collaborating with engineers, neuroscientists, and data analysts to develop prototypes that meet real-world demands. Funding and partnerships with industry leaders are equally critical, ensuring we have the resources to scale our innovations. Equally important is training the next generation of physiotherapists to adapt to these tools seamlessly. Without skilled practitioners, even the most sophisticated equipment can become redundant. At Mihira Care, we have initiated specialized training programs to equip therapists with the necessary skills to harness these technologies effectively. The ongoing focus of Mihira Care remains threefold: refinement, education, and outreach. Refining our prototypes involves rigorous testing and iterations based on clinical feedback. Educational initiatives will ensure physiotherapists worldwide are adept at integrating advanced equipment into their practices. Finally, outreach programs aim to extend these solutions to underserved communities, embodying the ethos of Mihira Care as a catalyst for accessible and equitable healthcare. In conclusion, Mihira Care's advanced equipment research isn't just about technological breakthroughs, it's about reshaping lives and empowering patients and therapists alike. Thank you for being a part of this journey toward a healthier, more resilient future.
That is the end of your OET listening test. Now check the answers.